Hi, welcome to Health Vision, WOUB's program on medicine and health. I'm Jackie Wolf, Associate Professor of Social Medicine at Ohio University. Today I'm talking to Frances Gander about Chinese medicine. Frances, welcome to Health Vision.
Happy to be here.
Let's talk a little bit about traditional Chinese medicine because it has a number of components, and let's let our viewers understand what those components are. And you do many of these components yourself. You know a lot about herbs, you know a lot about acupuncture, you know about moxibustion. Explain how those components work together and what exactly makes up traditional Chinese medicine.
Well, traditional Chinese medicine, as you know it, in the United States has been mainly centered around acupuncture and the needles.
However, and that's what people are aware of. When
yes.
people think of Chinese medicine, they think of acupuncture.
Yes, and if insurance covers it, that's the part they cover.
They don't cover herbs, and they don't cover.
No, they don't.
But if they do cover it at all, some companies might cover acupuncture.
Yes, in many states, insurance does cover acupuncture.
But there's a lot more to Chinese medicine than acupuncture.
Yes, there's a lot more. As you get into the study of it, you find that there's a relationship with the whole wide universe, actually, and that includes feng shui, and which is the study of the environmental influences.
We've done a health vision on feng shui.
Yeah, sure. See, so you are familiar with that. And then there's moxibustion, which is an ancient technique of heating, which heating is very therapeutic, forms of heat. And of course,
heating specific areas
yes,
of the skin.
Right, specific acupuncture points along with needling. And sometimes broader areas. And then there's also something called a TDP lamp, which is therapeutic device something or other, and patented in China, that is a magnetic heat lamp that is very therapeutic on broad areas of the skin, such as when there's a backache. It works.
How did you get interested in this, and where did you get your training?
I got interested in it quite a long time ago through the study of the movement arts of Tai Chi and Qigong, because they use the same theories. Although many times when I was taught, we were not taught the theories, but I had went into other study on my own, and I thought, well, this is really interesting to think that we have something called the 5 elements that's in us, that's in these movements, and that's in the universe, and the idea of the yin and yang transformation that goes on in all of life. And as time went on, I thought, well, I really would like to study a healing art. And since acupuncture was available for study since starting about the mid-'80s in most parts of the United States.
Yeah, it really wasn't available for study here in the U.S. before the mid-'80s.
Not much, no. Maybe a few schools on the West Coast.
And when you go, so you went to a school specifically to study acupuncture, is that right? And but you also use Chinese herbs in your treatment, is that right?
Yes.
Do you learn about how to do that in acupuncture school? Is all that tied in together?
Some schools teach it with the acupuncture, but my school taught it as after graduation, a postgraduate special course, and it was 2.5 years of long weekends.
So you have studied this for quite a long time. This isn't
I continue to study.
And is moxibustion also, that's something you also learn when you're studying acupuncture, or is that another course?
No, that's with acupuncture. And some people don't use that anymore because it is kind of labor intensive. And some office buildings have a problem with the smoke that it produces, although there is smokeless moxa.
Let's talk a little bit, let's describe acupuncture a little bit and then talk about how you use both acupuncture and herbs and kind of conjoin the treatments. Acupuncture, for people who might not be familiar with it, is based on certain points that have been mapped on the body. Is that right?
Right.
And explain what an acupuncture or acupressure point is.
Okay, there are gates, in a way, on these meridian lines that you can see on the acupuncture.
Okay, now you just used another word, meridian line.
Okay.
Now explain that, because that is something that is not a concept in Western medicine.
True.
So Westerners, when you say meridians, what are you talking about? Meridians, they'll say.
Okay, they tend to follow the major blood vessels and bones.
And this is what confuses Westerners, because you can see bones, you can see blood vessels, but you can't see meridians.
No, you cannot. But when we feel acupuncture points, when we palpate, first of all, we have a measurement that we use, and after a while you get so that you can eyeball it and go for the ones that you're really familiar with. But in the beginning, we learned something called anatomical Chinese inch, ACI, which varies if a person has very long legs or short legs, so you have to have that variable measurement.
Oh, I see. So the acupuncture points then are, depending on the size of the person's body, they're in slightly different places. It's not like you can say exactly, you have to study the person or not. Am I wrong?
No, it is still in the same place, because it might be right at the place where two bones join. And the two bones would join the same place on a short person or a tall person. But when you get to the acupuncture points that are further down the leg, for example, then you might have to use some measurement system. And so first of all, when you're learning, you learn measurement. You have to really go by measurement and be exact about it. And we get tested on that a lot in school before we start working on real people. And then after that, you get, so you palpate, you feel where the acupuncture point is, similarly to how we feel get a reading, an energetic reading of the body by feeling the radial pulses.
Let's actually see how you do this. Let's look at a typical session,
Okay.
and we can talk about it as we're watching. Because, okay, in this session, now this is an example of acupuncture here, where you take the very thin, this is not painful, is it?
Well, sometimes people do feel a little pinch or a sensation when the needle is inserted into the skin.
And exactly what are you doing for this particular person? What is this acupuncture point? What are you healing here or facilitating?
I'm working to harmonize her liver energetic. She's in recovery from liver cancer.
And now this is an example, is this an example of moxibustion here?
Yes, and what I'm doing here is putting a thing like top chapstick on the skin so that the material, which is kind of a fuzzy hand-shaped material.
Now,
of
does
moxa.
this hurt?
And no, it is not hurt. It gradually burns and gets warm, and when the patient feels the warmth, she tells me about it, and I immediately will lift this
And
off.
what is the effect here? What are you trying to do?
I am doing this technique in this case to nourish her blood. See, she jumped a little bit, so she didn't tell me quick enough.
Now, when you say nourish the blood, what is something actually entering the skin? What?
There is a lot of blood along the long bones of the legs. So these meridians, there are some points that nourish the blood that are located along those long bones.
But is there something going into the skin then from that little piece that you burned?
That is something that I believe that there is, but since I can't read Chinese, I can't really get to the research that they've done on it.
So what is that made of? The thing that
It's mugwort.
Mugwort, and is that an herb?
That is an herb that grows all over the world, a weed. And the kind we use has to be furry, as you see it, in order to be formed into those little shapes. And that usually will come from India or parts of Asia.